to the channel. This is Dang GH YouTube platform, your #1 live in the UK test learning platform, as well as UK and MC CBT exams. So if this is your first time, kindly check out our YouTube channel. The amazing video that we've made concerning CBT, that is for all specialties, then live in the UK test as well. In addition to that, we have amazing videos for your OSCE preparation, so you can check that one as well. Thank you. Hope you've enjoyed our previous video. This is the first video on the NMC Code of Conduct. The other one was just an overview of the NMC Code of Conduct. So what I'll be doing today is to start with the first core theme of the NMC Code of Conduct, which is prioritize people. All right, so what does this mean, and what are some of the things that you can do to demonstrate that you are prioritizing people? I'll be discussing all of these things, and right after video I'll be dropping some questions to try your hands on. So what the prioritize people means is you put the interest of people using or needing nursing or midwifery services first. You make sure that their care and safety is your main concern, and their dignity is preserved, and their needs are recognized, assessed, and responded to. Okay, so let me just, it means put service users first. So the service users can be students, can be the patient, can be the family members of the patient. These are all service users, so you put their needs first, and they are saying that make sure their dignity is preserved. Some of the things that you can do to ensure that people's dignity is preserved is to maintain privacy. The conversation should be done in private. Providing privacy is a way of ensuring that the dignity of people is being recognized, and it is being preserved. Then make sure their needs are recognized, assessed, and responded to. So make sure you respond to the needs of people every time. Make sure that those receiving care are treated with respect. So respect in the sense of you address people by their name if they have pronouns. Okay, so there are others who prefer to be called he, she, they, them. I mean, once the person identifies as this and they tell you, you have to respect it and go by that. So that is a way of treating people with respect, and that their rights are upheld, and that any discriminatory attitudes and behavior towards those receiving care are challenged. Now let me explain this part because it's very, very necessary. What they are saying is whenever you see any act of discrimination, you are to challenge it. The challenge it here does not mean go and fight with the person, or maybe quarrel, or there should be an altercation with the person. What it basically means is once you see something that is wrong, that is an act of discrimination, you have to tell the person that what they are doing is wrong. Okay, so assuming you see a nurse telling maybe someone who has learning disability that because of their disability they cannot be attended to, that is an act of discrimination. So what you do as a nurse, a colleague nurse, is to challenge. That is the first thing that you should do. That is to tell your colleague nurse that what he or she is doing is inappropriate and it goes against the NMC Code of Conduct. That is what the challenging means. Once this is done, then you can go ahead and report the person to your line manager. That is, it's as simple as that. So that is what challenging means. It means let the person know that this and this and this is wrong. It goes against this policy, it goes against the code, or whatever law that it goes against it. Okay, so that is what the challenging means. Treat people as individuals and uphold their dignity. It means we are all unique. Okay, we are from different backgrounds, different religious, cultural backgrounds. We have different beliefs, different norms. So you have to treat people as unique, Okay, that is treat them as individual, and treat them with kindness, respect, and compassion. This is easy to understand. Make sure that you deliver the fundamentals of care effectively, and avoid making assumptions, and recognize diversity and individual choice. So avoid making assumptions comes under prioritizing people. What it means is that because we are unique, we are from different backgrounds, you don't need to think that this person A will like this because they are from this tribe or this group. That is an assumption. However, what you can do to avoid this is recognize what diversity. So most importantly, you are to ask people what they like, what they dislike. So assuming when it comes to diet, let the person know, what do you prefer? Do you prefer tea? Do you prefer coffee? Do you prefer mashed potato? Do you prefer this? Ask them always. Listen to people and respond to their preferences and concerns. I think I've explained this. Then work in partnership with people to make sure you deliver care effectively. So work in partnership with people. Whenever you are drawing care plan, you are to involve what? The patient. Whatever care that you are planning for the patient, you don't go and plan the care and bring it to the patient. You are to involve what? The person. This is what we term co-production. It means 50-50. The nurse and what? The patient working hand in hand. Co-production. Recognize and respect the contribution that people can make to their own health and well-being. Respect and recognize the contribution as far as they can go. So assuming a patient, you tell the patient that you are to maybe exercise 10 minutes a day, okay, and the patient tells you, I can do 5 minutes. That is their contribution. That is what they can do. Do you get it? It means when that happens, you have to respect and recognize that that is the best that they can do in that situation. Okay. Encourage and empower people to share their decisions about their treatment and care. Respect the level to which people receiving care want to be involved in decisions about their own health. So if you are giving a patient information and they say that they don't want to talk about this at this time, just respect it. Come back later and offer to help, or maybe offer them if they would want to talk about it at that moment in time. Respect, support, and document persons to accept or refuse care and treatment. So every person has the right to accept or refuse treatment. That is if they have the capacity to give the consent. We will talk more about consent and capacity, but your duty as a nurse or a midwife is you give out patient the information, okay, and once they understand the information, they know the actions and the consequences of their choices, okay. Once they refuse that treatment or that recommendation that you are giving, you have to respect it. Yours is to just document. People have the liberty to do whatever they want to do. So once you give information and they make a decision and you even think it's unwise, you have to still accept it and just document. Recognize when people are anxious or in distress and respond compassionately and politely. So when someone is anxious, maybe the person is undergoing a certain surgery and they are anxious, okay, you have to respond compassionately and politely. So what you can do is you can tell them more about the procedure, give them detailed information. You can even offer to stay with them during that procedure if they would want to. That is you offering yourself or responding compassionately to the needs of that individual. Make sure that people's physical, social, and psychological needs are assessed and responded to. This one has to do with take care. It means care that takes into consideration not just the physical aspect of the individual, but the social and psychological needs of the person. It covers all angles. So that is what a holistic care means. To act in partnership with those in receiving care, helping them to access relevant health and social care information and support when they need it. So health and social care information. So if the person is going through challenges, that is maybe with housing, that is a social issue, right? So you have to tell them the support that they can have, that is maybe access to benefits, access to housing, that is you have to give for that information to the person. Then act as an advocate for the vulnerable, challenging poor practice and discriminatory attitudes and behaviors relating to their care. So I've explained the challenging poor practice and discriminatory attitudes already. So the vulnerable are the vulnerable adults, pregnant women, children. Okay, so these people are considered vulnerable. So you are as an advocate, you are to speak up for them in cases where they cannot speak up for themselves. So that is you being what? An advocate, and standing for the right thing to be done when it comes to these vulnerable groups. Then you are to act in the best interest of people at all times and make sure that you get properly informed consent and document it before carrying out any action. So consent means that you are seeking the permission of the person that you are providing the care for. So if I'm to check your vital signs, I have to ask you, is it okay I check your vitals? And you say yes, then it means you've given me consent. That is what it means. So whatever procedure or whatever action that needs to be taken regarding the care of people, you have to seek their consent. We'll talk more about consent as a topic. That is a very, very important topic, so I'll talk more about that one. Then keep to all relevant laws about mental capacity, health capacity, and mental health act. I'll be talking solely on these topics. All colleagues, your manager and the person receiving care, if you have a consensuous objection to a particular procedure, and arrange for a suitably qualified colleague to take over responsibility for that person's care. All right, so this one is talking about consensuous objection. I will make another full video on it, probably maybe when I'm done with this code of conduct. So I will talk about consensuous objection. That is another important aspect. Respect people's right to privacy and work confidentiality. So you are not to share patient information. Whatever the patient discusses with you remains private, remains between you and the patient. So that is you respecting privacy and confidentiality. However, there are some exceptions. There are some times where you can breach patient confidentiality, and that one will be discussed in the subsequent topics about confidentiality as a whole. But apart from these exceptions, it means that whatever the patient discusses with you remains private. It goes beyond just privacy, that is discussion remaining private. It also involves how patient information is shared, how it is being stored, okay, and who has access to it. So assuming you give your password to someone who is unauthorized, your password is for you alone. Do you get it? So the moment you share your password, it means you are breaching confidentiality. That is it. And you are not to leave patient information in public spaces where people can just have access to it. So that one will be discussed into much detail when it comes to confidentiality. So it says respect persons' right to privacy in all aspects of their care. make sure that people are informed about how and why information is used and shared by those who will be receiving or providing care. So whenever you are sharing any patient information, even with another health professional, you have to let the patient know that due to this and this and this, I'm sharing this information to this healthcare professional. The fact that someone is dead does not guarantee that you breach their confidentiality or you share their information. It still remains intact even when they are dead. So this is also one way of you showing respect, okay, and protecting the dignity of what patient. So that is what it means. Some discussions that are very sensitive, so you need to know your way of going about these things, especially for example when it comes to end of life discussions. You have to discuss matters sensitively as far as the law allows. So if there are limitations on what you can share and what you cannot share, you have to respect that. So basically these are the things that are necessary and prioritizing people. But as we go on and I pick out those topics from it to explain it further, then you get a full understanding of these things. Thank you for joining today, and just try your hands on these questions that will be showing on your screen. Then you can drop your answers at the comment section, and I'll review it myself and give you feedback whether you are wrong or correct. I wish you all the best, and I hope you follow up with the next video. Thank you.